live session of our YouTube live question answer session, and something in relation to respiratory disorders today, because there were a lot of queries on the Instagram and a lot of queries on the WhatsApp group about elements regarding cough cold during this season. And it is so important, to understand how to prescribe remedies and when to prescribe which remedies. Sometimes, we fail. Some common remedies have some wonderful symptoms of cough and cold, but we fail to understand those symptoms. For example, if you tell anybody about cough and cold, so it basically comes that whenever there is cough and cold, we have only one few remedies which are very, very important. And as I have talked lots about those remedies like hipparasulf, like nitric acid, like causticum, like lacases, like phosphorus, like rustox. But there are so many other remedies where it is indicated for such important complaints that sometimes you fail to understand those remedies. Sometimes we feel that the remedy is very acute and it will not work, but it does work. One remedy which I would like to suggest today, and it's a very, very interesting remedy which I have again told before my lot of times, but there were so many questions, so that I'll answer one of the remedies. One important remedy that you should always remember. I welcome Dr. Vishal, Dr. Rucha, Dr. Vishal, good afternoon. Dr. Anja, Dr. Mid. So there's one remedy which is again very important for cough symptoms, and that remedy basically I would tell you is Seneca. Seneca, remember one thing. A Seneca patient, of course, I told you something about the cough, something about expectoration, but Seneca patient has pain in the back when he starts coughing. This is again a very, very important symptom that a Seneca patient has. Remember this, Seneca patient has bursting pain in the back on coughing. I had a very interesting case of a patient admitted in the ICU. He had taken a lot of treatment, but the doctor told that you can go home now. He was very weak. There was a lot of cough. The cough had to be suctioned out, and he had a very typical symptom. The patient's relative came and told me that whenever the patient is breathing, there is a lot of rattling in the throat. Here, not in the nose and not in the chest, rattling in the throat. So I prescribed him Seneca 1M, local application upper limb, 3 times a day for 2 days, and the rattling stopped. The patient could start talking. The patient today in the morning, he came and told me that he drank a cup of tea also. This is the importance of interpreting a symptom and understanding the meaning of symptom. The remedy was Seneca. That's why Seneca has a very important symptom, catarrh of larynx. Do you remember Seneca has symptoms? Now, catarrh of larynx basically would have, we don't remember because it is not so important, but this case, an emergency case of the ICU, we prescribed the patient simple remedy Seneca, and the patient came out beautifully with Seneca 1M 3 times a day for 2 days. Welcome, Dr. Almagir. So this is the importance of knowing symptoms. If you don't know symptoms, then how will you be able to prescribe? So interpretation of symptom is important. In fact, if you see in Seneca, it is written the throat feels very narrow. If the throat feels narrow, the mucus or the catarrh does not come out. That's again a very, very important symptom of Seneca. That's why I tell everybody, is a lot of people ask me, sir, from where do you read Mathematica? From which books are important? The basic books are important because whenever you read that remedy again and again, something new crops up. For example, I told you something about Seneca a few days back or in the YouTube, like rattling of chest like Antimtat, or I told you that cough ends in a sneeze. But in this case, see the symptom which we took for precision. Catarrh of larynx and a throat feels narrow, that the mucus does not come out. And that is the importance of Seneca. This is the importance of understanding the remedy and understanding the symptoms of the remedy, that will be able to prescribe simple remedies. No need to, I don't basically tell you to read some rare remedies. Simple remedies, Seneca, and that helped the patient to get out of his comatose stage, and a lot of cough and a lot of suction was required. Seneca cured the case. In practice, it is possible that whenever the word rattling comes, you immediately think about Antimtat, but everything is not Antimtat. One more remedy I remember, in my practice, which I have used, and Yeah, welcome, Dr. Indrajit. And that is an important remedy where the patient says that there is child rubs the face, with the fist during cough. You go for a visit and in a house, and the child, you feel lot of cough is there. You're not able to differentiate which remedy to give. Just observe the child. If you observe the child and the child rubs the face with the fist, a very important remedy, I have prescribed lots and got good results. Is doctor is squilla. Squilla again is a very very important remedy where the child rubs the face with fist during cough, and there is always in squilla I have seen sneezing with coughing. Again, a very very interesting, a very very important remedy. I hope you understand. Okay, lots of disturbance. Dr. Vansh, you can't hear me properly? I hope everybody can hear me properly. Dr. Mithal is there. Dr. Ganesh, you to Indrajit, welcome. Sir, patient age 57 years, 10 years से Parkinson, 4 साल. It's okay. Okay, thank you. 4 years, 4 साल से mild fever है. Fever, child is TB, history, run tuberculum, one name single. No, see, it is not always that whenever there is history of TB, you must think of tuberculinum. In this case, Dr. Ganesh, whatever I can hear from your case, in this case, try to, yeah, thank you so much. I can, in this case, Dr. Pandey, a very interesting question. And normally, so whatever written in books, it is there, tuberculum is there. But in your case, whatever I can understand, you must try one remedy, and that is Ipecac. Ipecac, sometimes, I always tell to my students, is a remedy which is not used according to its importance. It is such a fantastic remedy, Ipecac. If you open your Mater Medica and see Ipecac, of course, there are the symptoms you all know, but there are few symptoms which are so important, And one symptom I've seen of Ipecac, that the chest feels full of phlegm, but does not yield on coughing. Remember this line, my friends. Remember this line. पेशेंट बोलता है मेरे को इतनी खांसी है, खर्र 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 आवाज आती है, बट निकलता कुछ नहीं. There is lot of phlegm in the chest, does not come out, and that's why normally we prescribe antium tart. It does not work, not because the problem is in the remedy, problem is in your interpretation. Ipecac is such a wonderful remedy. I have seen lot of cases of Ipecac cough. In fact, if the patient becomes very dyspneic, there is loss of oxygen, he turns cyanosis very close to carbohydrates. But Ipecac is a fantastic remedy. Lot of mucus in the chest, but does not come out. So do think about Ipecac also when you think about that Dr. Ganesh. One more thing. In Ipecac, the cough is so severe. Now I have told you minute gun cough, I have told you dry cough, I have told you cough in paroxysms. Remember that, but remember this also. Ipecac cough is so violent, so insistent. Every breath, with every breath there is cough. That is an important symptom of Ipecac. So do think about these two, and there are few remedies also. Also, I won't go into details of Ipecac, of course, because of so much coughing, the patient lands up in complete aphonia, and that's Ipecac when you have to prescribe. I hope you understand Ipecac and Dr. Pandey. So these are 3-4 remedies. Do think about one more remedy that is very very important. That is mephitis. And constitutional wise, you can think about tuberculum, you think about calcarea phos, you think about phosphorus, and you can think about ferrum phos also. Sir, is it symptomatic patient like renal calculi, diabetes patient are on elevated patient and no symptom are found? How to approach such cases? Yes, welcome. Instagram, Dr. Korane, Dr. Amulya. Yeah. So I hope, I'm sorry if I cannot pronounce the name properly. So Dr. Indrajit, yeah, very interesting question. And when you grow in your practice, आप जब practice में ऊपर जाएंगे, good evening Dr. Amulya. So you will, from cough, cold, coryza, pimple, melasma, falling off hairs, you will start getting symptoms, patients of diabetes, blood pressure, cancer. And it is seen that patient has diabetes, with that he gets a bonus of blood pressure also and thyroid also. In these cases, it is so important that case taking should be of the patient and not of the disease. In case of thyroid disorder, don't take symptom. The patient has severe constipation, requires lot of straining, and stools cannot come, because that is a normal symptom of hypothyroidism. Don't take the patient is very thirsty and because of thirst he cannot wait for thirst. That is a normal symptom of diabetes. So in this case taking is very precise. Rule out all the symptoms of disease and take in the symptoms of the patient. In this case, what I do important is understand the sora of the patient. Sora, because sora of the patient is absolutely pure. As I always say, sora is basically the truth of life. Sora is the innocence. Everybody do listen. Uh, Everybody wanted something about miasm. Take this as a clinical tip. Sora is innocence. You always love beautiful children's playing because they always play with their hearts out. As they grow big, they understand what to talk, how to talk, where to talk, what to talk, and then the innocence is broken. When the innocence starts getting broken up, the disease or the symptom of disease starts coming up in our system. And that's how psychosis comes and that's how syphilis comes. It depends how much innocence has been broken in your case, and that's why you got these type of diseases. That is the importance of sora. So Dr. Indrajit, ask the sora, and you'll be able to compare how did the journey from sora to syphilis has gone. Okay, just a minute. I have questions on Instagram. Uh, Tango kid, very intelligent, has memory issues, conversation issues, good, but did in language. What remedy can be thought of? You can think about Calcarea carp, Calcarea fos, Tarantula, Natrimur, Thuja, and phosphorus. Dr. Mulia, sir, please give the indications of bromium in molluscum if Thuja and Silicia fails. Bromium in molluscum, I have still not used in my practice because it's not always that Thuja and Silicia I have told you it will work. These are the cases where I have got maximum results. But bromium I have not used in cases of molluscum. So, but still, if you want some symptoms of bromium, so I would like to tell you, you can write down some symptoms of bromium. In bromium, it is very important to understand that there are acnes, pustules, and pimples type eruptions in bromium. First thing. Second thing, in bromium, it is important that whenever molluscum comes, there is itching, and when there is itching, they discharge from that, and again one of the molluscum starts, so it spreads. That's what I've seen in whatever cases I've used bromium in practice. Next question, Dr. Arora, welcome. Clear, we can hear you. Remedies for urinary incontinence in females, especially during coughing and sneezing. Yeah, so urinary incontinence in females, as such, if you see incontinence and cough, it is simple as that. You can think about causticum, think about hipazolf, think about drosera, think about phosphorus. There are lots of remedies. So if you prescribe in these type of symptoms, you may or you may not get result because the sphincter in females sometimes becomes fragile, and that causes the sputofuration. So in this case, if it is very marking, take it. Otherwise, take some other symptoms for cough. Whatever I have experienced in my practice. Clenched teeth, tightly tongue sticks to the palate. Yeah, so you know what, in this case, one thing is important to understand, in clenched teeth and what symptom, Dr. Anja? Yeah. So in this case, there are 3-4 remedies which are so very important, and you'll be surprised that I have got very good results from one of the remedies, that is podophyllum. Though it is rare, but I have got very important result with podophyllum. Second is hyoscyamus, third is belladonna, and fourth is chamomilla. The most of the time I use those remedies. Of course, apart from that, there are a lot many of remedies. Especially podophyllum is indicated when the teeth are clenched together during dentation. It's a wonderful remedy. Don't always think about the dentational remedies like ethuza or chamomilla or other calcareas and all. Podophyllum is a very interesting remedy when there's clenched teeth during dentation. Allergic rhinitis, nasal irritation at rubs the nose, palate itching so much after bathing. Now see, allergic rhinitis, if you take this basically symptom itching and rubbing of the nose, sometimes what happens, this becomes a very normal symptom, and you may only give relief temporary to the patient. But still, if you ask me the question, there are few remedies which I have used: Allium cepa, Sabadilla, Orando, Histamine, Pulsatilla, Nux vomica, Spigelia. These 7 to 8 remedies are very useful in these complaints what you have asked the question. Dr. Sevilindra, yeah, welcome. Sir, grayish dry scalp from nose has to remove by fingers. Person catches cold easily. Yeah. So normally, if you get these type of scabs, a type of what you call, the patient takes out the scabs and all. No, again, if you are, it's very commendable that the patient has told you exactly grayish type of scabs. Normally, what happens? The patient comes to us, and the most common, basically, it is like the patient removes these scabs, and there is a raw spot in the nose, and then we think about remedy like phosphorus or Kalibichor, Mathuja and all. And normally we see bloody scabs. But grey scabs, I have few cases, and I had where the scabs were grayish and the scabs were green. You can write down one of the very interesting remedies. Doctor, who has asked me the question? Dr. Amit. Hippozynium is a very important remedy when the scabs are grayish. Together, add to that remedy Elianthus glandulosa, where the scabs are grey in color. I hope, Dr. Amulya, I have answered your question. Okay. Yeah, good afternoon, Dr. Kocher. Thank you, Dr. Smith. Some questions on Instagram might have scrolled up. So if I have not answered, do ask me, because there are a lot of questions there. So I hope you got something about this. Yeah. So I think all the questions have been answered. So so we'll continue, Amit. And yeah, one question is on Instagram, like, what about the green scabs? Now, whenever the scabs are green, so in green, two things you have to ask the patient. Sometimes the scabs are so big, they appear like masses, So green scabs, the remedy would be phosphorus, nitric acid, Kalibichor. But there are green masses. The remedy becomes Kalibichor, sepia, and Teucrium marum verum. These are very important remedies, And remember one symptom, as you have asked, sometimes the scabs are very hard, and the patient comes to you and tells you, my scab, it is so hard like a stone. Actually, he is telling you the remedy. The scabs are very hard. Think about one important remedy: Kalibichor, nitric acid, and lachesis. And if you see the nose symptoms, scabs, discharge from the nose, itching, one remedy will come in most of the symptoms, and that is Kalibichor. Hard to detach scab is also Kalibichor. Green masses is Kalibichor. Green is Kalibichor. So lot of symptoms of Kalibichor basically are in the nose in relation to scab. So do study about this scab, the symptoms of the scabs. Of course, there are other symptoms also, the differentiating of the scabs. But I have not seen in my clinical practice. I have seen only scabs removed leaves a raw spot, bloody scabs, greenish scabs, grey scabs, and the masses type. There are again other symptoms like of what you call orange type, which I have never seen, so I don't need to tell you. Yellow scabs, yeah, you do have symptoms, you do have remedies for yellow scabs. So in this, only clinically 4 or 5 scabs type of eruptions are sufficient for practice, Welcome, Dr. Mona Swami. So I hope you understood something about this scab formation, an interesting symptom and an interesting remedies also. So as we go further, I hope you, headache with sensation if iron rod is going in one side of the temple and just a minute, coming out of the other. Oh my God. So see, if you have this type of symptom, iron rod, always I say that in homeopathy, it is not always important that you will get all symptoms in your Mater Medica. Now, this symptom of iron rod, if you open your Mater Medica, there are some remedies, but I would still feel that you think about some other symptom too, because in migraine, I have got fantastic result in my migraine clinic. These type of sensation, what happens, you give the remedy, that part of sensation goes, other things starts coming. So you have to have symptoms which are more specific and more defining. In your case, you have to think about 2 or 3 remedies, Dr. Smith. First would be basilinum, and one remedy which is very, very rare, but I have used in my practice before, that is fucus vesiculosis. So this is again a very, very important remedy that you should think about in these type of symptom. And of course, don't forget to use one remedy, that is aconite. These 3 remedies very, very important in this case. Just a minute, I have a question on Instagram. Doctor, sir, there is a rash itching without any scaly daytime itching is more episode and attermost success given, but itching aggravates. How to approach this type of cases? See, whenever there is itching without any scab, without any scales, see what happens whenever there is itching. If you are basic, if I can understand your question, Dr. Amulya, itching without eruptions, do you want itching without eruptions, is that what you're asking? So whenever there is lot itching in the nose, you're asking, Dr. Amuli, I just read the question. Patient given aggravates, how to approach this case? No, if there is itching and there is no eruptions and there is no scab formation, do think about diascoria. And see, there are a lot of other remedies, in skin, where there is what you call, where there is no eruptions, like for instance, you can think about diascoria, Dolichus purpura. Second remedy you can think about is miserinum, alumina, and sulfur also. But with this symptom, you do add some symptoms also, to get exact remedy. I have got very good results with Dolichus, good results with mercury, and good results with alumina also. Dr. Palak, good morning, Doctor. Good afternoon, Dr. Sharma. Good afternoon. So, low confidence in child, too location, but stammering and shutters with anxiety. How to approach? No, see, the answer you have given in your question, Dr. Smita Krishna Kumar. Low in confidence, basically a person is not born with low confidence, no. So you have to understand why the patient has low in confidence. Whenever you have low in confidence personality and they start to speak very fast, normally they have a problem of stammering. So in this case, the most an anxiety and everything is basically a secondary symptom of those symptoms. So first of all, in case taking, you have to first understand basically what and why the patient basically develop this type of low in confidence. If you open the repertory also, if you open the repertory and see what are the remedies for low in confidence, there will be so many remedies, and these basically are all psoric symptoms. So go beyond that, why the low confidence is there, and automatically you will start getting your answers. For example, low in confidence, maybe the parents are not living together, parents are fighting, the child is bullied, there's a lot of comparison, siblings are there, elder and younger ones, there are a lot of dominance, there are a lot of abuse. That creates sometimes loss of low in confidence. You have to approach the case in this manner, and then you'll be able to understand the case better. Himani, Dr. Deepa, welcome. Dr. Badri, Z. I can't answer that question. Z. Mishra ji, good afternoon. So, as you go further, pain in calf muscles in left leg, stitching in muscles all the time. This question actually has been asked so many times, pain in calf muscles. Now, you'll have a lot of cases where, the patient comes and tells you that the calves are very painful and the calves are very hard, then there is cramp-like pain in the calves. And also in homeopathy, of course, you have to add few symptoms with this, but there are some remedies which are very, very common and very, very important in these cases. I had told you before also, the remedy which I have used in my practice and got good results would be Agaricus muscarius. The second remedy would be sulfur, third would be phosphorus, fourth will be phosphoric acid, and fifth would be natriumur. And then basically understand why the patient is suffering from more in the morning, more in the night, and the patient is better by stretching the limbs or sitting. Then when you go further, you start defining that pain of the calf muscles. It would be better so that you can zero down to the remedy if you have few symptoms more rather than only one symptom of pain in the calf muscles. Okay, yeah. Long bone pains for no reason. What can be the remedy? See, pain in the long bones, if there is, see, there has to be some reason for pain in the long bones. Whenever there is pain in the long bones, and what we call, whenever there is pain in the long bone, first of all, make sure that the patient basically has been eating a balanced diet with calcium. Basically, in the calcium is there in the body, and if it is not, then you have to supply that with food and with natural things. And then there are growing pain also, like when the child is growing, a lot of bony pains in the body. Third, bony pains, basically, if still you only want to treat bone pains, you can think about remedies like strontium carb, you can think about calcarea phos, you can think about asafoetida, muxol, and these are the remedies which are useful. Don't and acute remedies like I have told you before also, guaiacum is good, uh, guaiacum is good, Gaultheria is good, and Iranian dadana is good. But simple pains for long bones would be very difficult to prescribe. Go more in detail of the case, and I feel that most of the cases would be suffering from malnutrition, or they are not taking enough of calcium that may cause pain in the long bones. There is one more symptom, in a matermedica, pain in the bones which are very close to the skin. That is also a tibia bone, that's also long bone. So we have remedies for that also. So as we go further, some questions again have been scrolled up. Can you write the questions again? पेट पोट में कीड़ा ने लगाने वाला कुछ है पेड़ पौधों में. ओके, पेड़ पौधों में. सी व्हेनेवर आई हैव सीन इन केसेस ऑफ प्लांट्स के जिससे पत्ती लीव्स है तो उसमें बीच में होल हो जाता है बिकॉज उसमें कीड़ा लग जाता है. देयर आर फ्यू रेमेडीज विच आई फाउंड वेरी यूजफुल इन दिस टाइप ऑफ केसेस. यू कैन राइट, आप लिख सकते मिश्रा जी, एजेडिरेक्टा इंडिका, इचनीचा एंग्यूस्टिफोलिया. Third remedy that you should think about in homeopathy, you should think about is calendula. Fourth is muxol. These are the remedies which I have found very useful. Normally, what do I do? That I make a spray and then spray on the plants, and that gives me good results. सब questions खत्म हो गए? Any other questions? So I hope you understood today. I just wanted to share that case of Kathar and when Seneca worked beautifully, Yeah, general remedies for inflammatory muscles, rheumatism, simple as that. You go to the, yeah, welcome Dr. Smita. You go to the, what you call, now only we have some cases where you can say winter aggravates. So you can think about remedies like rustox. You can think about remedies like or metallicum, arsenic album, soranum, naxoimca. These are the remedies which are very, very useful in these type of conditions. Sir, ringworm medicine. Sir, please make video on pets. Okay. Sir, tell me about ringworm. Yeah, ringworm, I told you, there are 3-4 remedies which I had discussed last in my YouTube. Those were natramur, sepia, tellurium, azadirachta indica. These are the 4 remedies which I use very common. Then we come silicia, we have thuja, we have soranum, and we have basilinum. मक्सॉल सर, मिश्रा जी पोटेंसी 30 यूज करके देखिए. सर, एनी स्पेसिफिक मेडिसिन फॉर hygroma in knee joints in buffalo. Tried calcarea floor, no treatment in allopathy, doctors say. Basically, if you're treating a case of hygroma, whatever I have used in my practice, I'll share that, Dr. Chaudhary. That is lapis alba, thiosinaminium. These are the very, very important remedies. Third is thuja. So these are the 3 remedies which I have used in my practice with sporadic results. In few cases I have got good results, in few cases I have not got good results. But these are the remedies which I use in my practice, And you can also try and share your knowledge if you get results. In few cases I tried also calcarea carb, not calcarea floor, because calcarea floor there should be a lot of hardness of that hygroma or any part which you are prescribing. Moxol 30% Mishra ji. Yes. I hope yes, पेट्स पे वीडियो बनाएंगे हम, इंटरेस्टिंग है. जैसे मैं आई टोल्ड यू आई ट्रीटेड अ केस ऑफ distemper in dog. It was a fantastic case. Remedies to dissolve gout. I don't know, I can't tell you exact remedies, but I can tell you the remedies which are very, very useful in our practice, and that would give you results in most of the cases, in gout cases. So, you can write down the remedies. First of all, benzoic acid, very, very important. Second is colchicum, very, very important. Third would be, I would say, you can think about calibrom, again a very, very important remedy. So these are all remedies which causes inflammation, and inflammatory remedies basically in case of gout are very, very important. These three remedies would give you good results. There are other remedies also, like you can think about bryonia, you can think about calcarea carp, you can think about arnica also. So you can think about benzoic acid, colchicum, then the most ingredient remedy and calibrom. The other part you can think of bryonia, calcarea carp, and arnica. Who is Dr. Sweetie? I don't know. Okay. Forehead turning dark, reasons and remedies. Forehead turning dark, see, forget the reasons, because if you start medicine, will not be able to cover a homeopathy. So if the discoloration of the forehead, and in this case, I have also lots of cases, but the results may vary from person to person, and if you see how is the discoloration, it is blackish, it is grayish, it is brownish, you can go in the repertory, or in case of metrobody can prescribe the remedies. But normally I have seen that in this case also, if you prescribe constitutionally, it will give you good results rather than prescribing in only for the color of the forehead. For example, if you see that the forehead basically is very much, what you can say, uh, you can think about remedies like califos, we have phosphorus, we have sepia, we have colophyllum, but then yellowish, then reddish, then dusky red, then dirty red. But in general, forehead mein you can think about nitric acid, phosphorus, sepia, natrium carb, colophyllum. Sir, frequently used in your clinic in winter season, please. I just told you about these remedies. In winter season, of course, there are so many remedies for winter season, but the remedies which I have told you, for example, if you have seen Rustox, most of the doctors basically are prescribing Rustox, and that gives you fantastic results. In winter. Of course, in if you see in winter season, there may be a lot of remedies, but few remedies are very, very important. First is definitely Rustox. Second, think about Hiparsulf. Third, think about Pulsatilla. Fourth, think about Dulcamara. Fifth, think about arsenic. And sixth, think about what I have used in my practice. You can think about Sorinum also. So, hyperpigmentation in patients due to chronic dry eczema. Yeah, then you can use the symptoms, after the eczema, the area becomes blackish. That is called lichenification. So, if you have suppressed the eczema with other medicines, homeopathy medicines also, then the lichenification occurs, and it is very, very difficult to treat. Again, take the whole case and prescribe. So, if the eczema is cured according to the laws of homeopathy, nothing will remain after the treatment of eczema. If it has been suppressed, then the area becomes lichenified, and it's difficult to treat in those cases. Like I have cases in my Mumbai clinic where the patient had psoriasis. The psoriasis was cured, but the whole skin has become black. It is very difficult to treat those type of symptoms. Though the patient is improving, but it takes a long time, in my experience. Okay, so I hope everybody could get some answers to the questions. I hope I am able to give you some tips in your practice so that you can use that and treat your patients properly. Do we have some more questions? Okay, so that's all. It's already 3:30. So thank you everyone. Thank you for joining, and meet you on next Saturday for the next YouTube live. Thank you.